Kublank This, and I am with the great, the amazing, the extraordinary nurse of all nurses, Miss Arlene Maxim. How are you today, Arlene?
I'm good, John. How are you? You must look up all kinds of words before we do this, so you can come up with something different. I just love this. I don't think I've ever been so flattered in my life as I am with the introduction to Off the Cuff.
It's my favorite thing to do. We have two awesome guests today. Can you introduce them, Arlene?
Oh, I can. Yeah, sure. Absolutely. I have the honor to introduce two amazing people that I've met recently. And Diane Kuby is the co-chair, the co-executive of the center that we're going to be talking, this Cancer Safety Net Center that we're going to talk about today. And I also have Peggy Barton here, who is the president of the center. And they have some exciting things to talk about. I have never thought about, I guess I have, because I've had personal experience with it, but haven't thought about the financial burden when a patient is diagnosed with cancer, what kind of a burden is placed on not only them, but also the family and the hardships that they can run into, not only with their health, but financial wise. And I think Diane and Peggy can talk about, they actually have some research has been done about the dollars that people lose, the number of bankruptcies that take place when people actually have that diagnosis, and as they're going through their treatment, and the burden it places on not only the family, the patient, but also the family. So Peggy, if you could start out and introduce yourself and talk a little bit about your background, then we'll go to Diane, and we'll kick this off and get lots of questions. We have lots of questions already that have come through that we're going to talk about and get some answers to. And as John always says, those of you who are on live, please chat. We have chat available, right, John? That they can text. So please feel free to do that, and we'll answer any kind of questions you have. So Peggy, if it's all yours.
Sure. I'm a registered nurse, graduated over 50 years ago from nursing school, and right out of school became interested in oncology. And way back then, we didn't have much to offer to patients, and it was pretty much a diagnosis that was terminal. As time progressed and treatments developed, people began living longer to the point where today it's a chronic disease. It's not a death sentence anymore. But what I've noticed over the years, and what's become a passion of mine, is that patients who are medically underserved, or they don't have any insurance at all, have a very, very difficult time with a cancer diagnosis, and they will delay treatment. They will only get treatment when they can afford to get it. They have difficulties paying for their rent. I had a dear friend a number of years ago who delayed getting her mammogram because they didn't have insurance. And then by the time she got diagnosed, she was terminally ill. So, these are things that are really, really important, and they're called social determinants of health. They relates to how well you're able to pay your rent. Can you afford to buy food for your family? Do you have the funds to pay for childcare? And what happens what about your utilities? All of those different things that we all take for granted in the course of our day-to-day lives, patients who have a diagnosis of cancer can really struggle with, and they'll make decisions on what they will accept as treatment based on what they can afford. And so, I've been involved with this. I kind of chuckle because we started dealing with this in one of the practices that I worked with. I should go back and say I worked on the floor for 11 years as a staff nurse, giving treatments to patients when they were inpatient. And then I moved into an administrative director for oncology services at one of the local hospitals. And then I moved into private practice, running a practice for more than 18. and just recently retired.
Oh, good for you.
But the thing that we would see were these very same issues for patients who were medically underserved. They were making decisions about what they could afford and what they couldn't afford. And we started as a group, our staff, doing bake sales and gene days, raising money so they could help at least one family with food or, bus tickets or, a variety of things, rent. And we eventually developed a formal foundation, and it was through the National Cancer Care Alliance that I started talking with others who had similar foundations. And we realized that we could raise money locally to help our patients. But to take it nationally and gain a broader base and secure larger amounts of funds was going to take a national organization, which is the genesis of the Cancer Safety Net Foundation.
Excellent. Thank you so much. And so social determinants of health are like one of the mainstream ideas that CMS has now for collecting data. I know that there's been some ICD-10 codes now that are available for social determinants of health. And so you're right where you need to be with that. That's exactly what one of the main issues we have with all kinds of different diagnoses, but that's absolutely a problem.
Yeah, and one of the things that our practice has just started doing is navigation service for the patients. And they do collect that kind of information along with the financial counselors also collect that information. That's really important. And a zip code is an important piece of information to have as well.
Sure.
Yeah. Diane, do you want to introduce yourself a little bit?
Hi there. I'm Diane Kuby. I have a background in medical administration. And excuse me, I'm going to lose my voice as soon as I start talking here. My background started with running everything from small practices in the Washington, D.C. metropolitan area to then going on to working all the way into cancer centers. And so for many years, I was a medical administrator and ran a cancer center in the Washington area. And at the one point, we were one of the largest centers privately owned in the region. And from that, I went on and started getting very involved in some political things. And it was all because of changes in insurance, in reimbursements. And here I was negotiating for our 60 employees, their health insurance, but at the same time, negotiating what the payments were going to be, with how we could get our patients covered. And I was seeing patients come in to my office who had recent diagnoses with everything from breast cancer, lung cancer, whatever it happened to be. And suddenly they had insurance for 25 years that they had paid into through their jobs. A lot of them were federal employees. And suddenly after their insurance premiums went up $1,000 a month. Okay? And I had one woman walk in and burst into tears and say, I can't afford to live. I can't afford to have my treatment. So we have watched this, and that was, so we have watched this evolve and become worse as there's been more cutbacks, there's more issues. The price of cancer care is gone, skyrocketed.
Yeah.
And it's because of this, patients are now in a situation where they're sitting there going, can I go to the grocery store or am I going to get my treatment? Can I take care of my family? I left the practice when I was recruited to go with a new group that we basically were representing privately owned cancer centers, which at the time, 81% of all cancer patients in the country were being treated. They weren't in the big hospitals. They weren't in, massive clinics. They were in local oncology practices. And there was a thing happening on the Hill that they were going to revamp Medicare, and specifically oncology. And they called it the Medicare Modernization Act. When we looked at what was going to come out, it basically was taking the money away. That most of the practices were going to go out of business. It was that drastic. So a group of us, we were from all over the country, formed an organization, and I spent 5 years on Capitol Hill working on that act, on the Medicare Modernization Act. And we basically there's still issues going on, but we basically kept private oncology practices from going under because we said, look, this is how we've been paid. We didn't set this up, but we can't afford to, stay in practice. So that evolved to some international work that I was involved in. A number of members of Congress were involved in a congressional delegation that was going over to Ukraine when it was going to be the 20th anniversary of Chernobyl. They asked me to go along, which I did on 2 separate occasions, because they needed someone who had run a cancer practice, who knew what the cost was, because the Ukrainians they were rebuilding. It was after their Orange Revolution, and they were rebuilding their hospital infrastructure. And we saw facilities that would date back to the procedures of the 30s, 40s, that were so antiquated. And they were looking for guidance. And so they asked me to go along, and it was a real honor. So I've done, and I also was very involved in some of the state and local political things that were going on. And from there, I went to a presidential campaign staff. So I got pulled from one thing to another. And actually, our CFO for the group that I was with down on Capitol Hill called me and said, hey, we need to start this new foundation. Would you like to get involved? And he told me, I said, absolutely. I would be more than happy to get involved again. So that's how this all came about. And all of these practices that had either started foundations or local groups, we basically do not give directly to the patients because the local foundations know what's needed in their communities. One of the local groups, they're all over the country, that was out in New Mexico. Their patient population is a very strong indigenous population. A lot of American Indian, there's a reservation near them. And the patients that come in, some of them they don't even have water in some of their homes. Where their foundation put a hot water heater in their home. So you look at and let me take a step back to explain exactly what the Cancer Safety Net Foundation is. It's a 501c3. We have gone through all our regulatory, all the legal issues that we had to do to set it up. We want to function nationally. Our dream is to take it on an international basis because this is happening all over the world, even in countries that have social, medical care for their citizens. We basically looked at this and said, how can we help? And instead of giving directly to the patients, we want to support the foundations and charitable groups that are local because they know what their populations need. And that way, they know directly, because people usually wait till the last minute, and Peg can contest to that from a foundation she was involved in locally. If the last minute they said, they're going to cut my heat off, they're going to cut my electricity off.
Yeah, that's true.
I don't have any, I can't buy food for my family. Childcare is, there's instances where, in the mid 40s, there's been a huge increase in colon cancers in people under 50, and they have children, they have small children, and they need someone to care for them, and they can't afford to do it. They're losing time at work. They're losing time, some of them lose their insurances. So the combination of it all is the need is greater than you can possibly imagine. I don't think people have a reality of what it really is. And people that are going along, are perfectly fine, and then all of a sudden they have a cancer diagnosis and their life is turned upside down. They miss work and hourly workers. And what's interesting is that I just read a statistic that the cost of what is owed by patients to facilities, medical facilities, hospitals, that type of thing, is not the patients that are uninsured now, but it's the patients with 80/20 insurances. If they have insurance through their employee, but they have to pay a 20% copay. And once you get into hundreds of people, they can't afford to do this, and they don't have a secondary insurance. So the demographics of people that are in trouble now have shifted. And, so it's been a real interesting cycle to watch this and, to see it kind of go full circle. But we're hoping, we've gotten everything set up. We've gotten all of our, nonprofit status. We're all together, and we've reached the second stage, which is of our development, which is now we're doing the fundraising. And right now, that's probably the most important thing that we are addressing. We're looking for board of directors, new members for that. We started out with people basically in the medical community, but we want to branch out. We want to bring in corporate people. We want to bring in business people from, different avenues, because we really want to network this along so that people understand that it is affecting some of their employees. It's affecting people from all over, every socioeconomic level. So that's who we are. That's what we're about. And so anything we can tell you about the foundation, we're happy to do.
I've had instances with individuals that have been dealing with cancer, and very similar to what y'all are saying. It's all consuming, not just physically but mentally.
Mhm.
Can you talk on how the stress of not being able to provide food impedes on the physical care and you getting better? Like, that stress can't be good for the healing process.
No, it's really having an appropriate diet for your diagnosis is really, really important, because it helps you deal with the side effects of the treatment.
Sure.
If you don't get enough protein, you start losing weight. If you don't get enough calories, you start losing weight. And you don't want to lose weight when you're on cancer treatment if you can avoid it. So yeah, food is a very, very important part of the plan for care of a cancer patient. How do they stay nutritionally balanced while they're on treatment?
Right. We had one of our doctors told me a statistic of one of our last meetings that a patient with a stage 1 breast cancer, which is a very curable, cancer, that if they have food insecurity, their chances of dying from that disease go up by 20%. That is significant. And they've seen this. They have seen patients struggling. And like Peg was saying, that now, the questions that are being asked, we're looking at the social side of patients' lives. How many children do they have? What are their jobs? Income, that type of thing, of how are they going to cope with this? And
do they have elderly parents that they're taking care of? And I mean, because there's a lot of us in the sandwich generation.
Yes.
So,
exactly. So they look at it from all aspects of all of this. And when we started looking at the different geographic locations to see the needs, I mean, somebody in Detroit's going to have a whole different set maybe than someone who's, in Texas, or, and what other resources are in their communities. And what we're also seeing is, and COVID didn't help this. The pandemic didn't help it as well. So many of the groups and institutions have dispersed, or they don't have the volunteers, or they don't have the centers. And because people got into financial trouble then, when they didn't have, a lot of income because of COVID, and they couldn't work, there was such an additional need for, specifically for food sources in communities across the country, that they didn't have a way of helping this. And so that's why we were like, okay, we need to focus this on the cancer patients. And we were very specific with how the gets their aid. Somebody applies to us for a grant, they don't give the patient cash directly. They either we pay the bills directly. That's how most of the foundations and groups are. So that way we know it's taken care of. They pay their rent, they pay their mortgage directly to the vendors, their utility bills. They give food cards, gas cards. They make sure that their phones are paid for so that they have a way to communicate with their practices and with their help. And it is amazing when someone has that security that they can feed their family, the burden that takes off of them is just tremendous.
What do you see any geographic location that you see a larger need? Like, is it in the southern states that you see a larger need, or is it?
It's everywhere.
It's anywhere.
It's everywhere. Yeah,
everywhere.
It's.
We have been in touch with groups from all across the country, from the Northeast to the out west, Mid-Atlantic, everywhere. I mean, it's everywhere. And that's why I said that the having us help those foundations, and by taking this on a national level, our goal is to get larger donations, to get bigger grants. And we also have applied for grants. We are applying to corporations, to, different things within the health community, of organizations and companies and corporations that have their own grant programs or donation programs. We are actually, we've set a budget for this year and, and a goal of fundraising. And we know that it's going to take millions and millions of dollars to be able to get this care out to everyone. Mm-hmm. And we've talked to physicians overseas, and they've told us that, they have, had this problem too. And what's amazing is, yesterday I was out running errands and I ran into a shop to pick something up. And I ran into a friend of mine and she was like, "Hey, how are things going on the foundation?" And this woman overheard us, a lady standing next to us, overheard us talking about it. And she said, "What are you doing? What are you guys doing with this cancer thing?" And I explained to her what it was. And she started to cry. And she said, "I went through this with someone. I went through this with one of my best friends." And no matter where we talk about this or bring it up, I had a young man. I was at a meeting down in Washington, D.C., and a young man came in for the next meeting, and we were chatting, and he told me, I said, "What do you do?" And he had a very good job, and he said, "Well, what are you up to now?" And I was telling him, and he also got very emotional, and he said, "I lost my father to cancer." Mm-hmm. And he said, "We were only able," and when he passed away, and the gentleman was only 58 years old, he said, "We were just about ready to have to sell my mother's house because they had used all their savings to pay for everything that was covered." And he said, "When my dad died, his life insurance was the only thing that saved her." Wow. And they were looking at that, and he said, "Thank you, thank you, thank you for doing this." And Peg and I both have had this, just out of the blue, people come up and say things to us and just overhear it. And so it really brings, front and center how desperate people have been and how much of a problem this truly is. It's kind of been like kept under the surface.
I'm sorry, John. I would expect you would see very few people who haven't been touched by this in some way or another. I mean, that's family, whether it be family or John, you've been working in this. You've been working in hospice. John's been the administrative hospice for a number of years, and so he sees it every single day, and multiple families that are going through things like this.
Well, and it's, like it gets to be heartbreaking because the medical issue that they're going through is affecting their entire family, and then on top of it to have to deal with transportation or food or childcare, it becomes a lot. But I think also we're at a place now where, I have kids, and they always say, it takes a village, it takes a community. I think with this Cancer Safety Net Foundation, what you have is you're expanding that village, right, to actually have some muscle behind it, because as much as John Kublank wants to take care of his best friend, Matt, who has cancer, I may not have the financial time, whatever. I need help too. So I think it's just kind of making your village a little better, because like you said, everybody's going through it. So we all kind of need to help each other, right?
Exactly.
That's exactly true. Exactly true.
I have a good friend now. This person does not have cancer. One of my best friends, someone she grew up with, is a woman who had been a journalist at one point, never was married, and has had all types of health issues. And she's now going to have a second major surgery. She's living on less than $1,800 a month in Social Security. She's gone through every penny that she has. And we're sitting back here going, what's going to happen? And she's in her 70s. And we going through all the agencies, looking at everything, going through social services at the hospitals, and all of us trying to help her financially. We're sitting back going, there's nothing for her. There's no care. And she needs care, but the facilities that are costing $10,000 a month, and what we're seeing, the different crisis with the elderly people in this country, that their retirements, no matter what they say, it's not enough to get through those last, years. And we're all sitting back here going, what are we going to do? And we've called every kind of social service around, and we're trying to figure out what we're going to do with her. Because
and everybody's issues are always so different too.
Right.
It's like I like how y'all are allowing the local agencies to kind of diagnose or really get involved. If you were just giving out blank box and blank box had something for everybody, it's kind of a waste of money because some people are not going to need that support.
Exactly.
Yeah.
And we also are requiring, when we give a grant, that the recipient of the grant, the foundations or charitable groups that receive that grant, they have to report back on who we're not
on how they used it.
But we are going to ask, what the patient, what they gave it to them, how much they gave. And so they have to report back so that we know that the money we're giving them is not being misused. So we've set up margins as well. So, and we're trying, but very lean, not spending a lot of money. We're trying to keep the money's going to the patients, basically.
Peggy, you mentioned when you were introducing yourself about how cancer is not necessarily the acute disease that we used to think of cancer of, and people would be diagnosed and with X amount of time they would probably expire. Now it's become a chronic disease. So that would seem that the cost of cancer has gone up because now we live it longer. And so that probably impacts the same issue. The social determinants issue kind of goes on and on and on.
Yeah, in fact, it's probably a bigger issue now because of that increasing cost of care going over a longer period of time. Patients, like Diane was describing, they run out of money after a while, or they're not able to work. I have a niece whose husband has stage 4 cancer, and he had retired, and his insurance suddenly wasn't what they thought it was going to be, and they were scrambling trying to get him covered. And so, it really, and the cost of care, it's just amazing to me. I have another friend who has a leukemia, and the cost of the drugs that she is on it's mind-blowing what they're paying per month for these drugs.
Right.
And then they're also, the other thing that I think a lot of people, you probably know a lot about this, Arlene, with the work you're doing, is that a lot of the drugs are being taken off the formularies. There's a whole list under Medicare alone that we're looking at that are going in the next year or two are not going to be covered anymore. And
that's true.
And there's another problem too that a lot of people are not aware of, and those of us involved in medicine are these managers that are going in. The pharmaceutical companies, many of them have set up programs to assist patients that can't afford. But what's going on is there's a whole new breed of this middle management group that are doing negotiations, and I won't get into the whole thing because it's a little bit more complicated. But basically, those programs are being jeopardized that even the pharmaceutical companies have come up with to help the patients. They're running out of money because that, insurances that used to cover it are now not covering it because they're making all these deals. And what's happened is it's even less access to the medications. Yeah. And prices keep going up. So there's this double-edged sword going on behind the scenes within the insurance industry. And employers are, going, we can't afford to pay all these insurance premiums anymore. So they've got all these little experts that are coming in, and they're actually wreaking havoc and actually causing more problems and more cost. So there's a lot of things happening that we're fighting against here. And as off those formularies, there's going to be more issues and more cost for the patient.
And
then the patients.
I'm sorry, Peggy, go ahead.
The patients sit out there and struggle with, well, how am I going to get this covered? How am I going to get my treatment? And anything that we can do to help them is what our goal is looking at.
Yeah. So we want to be clear here that this foundation is not covering any healthcare issues. So you're not covering medications. Right. You're not covering any kind of anything to do with their medical condition, but you are with the social determinants helping out so that they have the cash then to augment whatever else needs to be done. Do you see an impact? Like I've been in meetings all morning this morning, we were talking about how the Medicare program itself by the year 2030, which is only 6 years away, will become advantage programs, that everyone's going to be pushed into an advantage program, which are now going to be managed. So the care and the treatment, as you're talking about with the medications, I would guess some of those medications, if they're too expensive, the managed care organization is not going to approve them.
Exactly. And you know what the worst
I would
part?
think that would happen.
Yeah. The worst part of this, Arlene, is that the latest studies out of the federal government are that those advantage programs that are supposed to be saving Medicare money actually cost the government more money per patient.
Right.
And which, you know, and of course, you know, the nickname in the medical field is they're the disadvantage, you know, is what they are. And, you know, play denied. And it's become a huge mess. And you know, everybody I know, and we had an incident in my own family. A lady who helps my daughter out, is our nanny for our grandsons. She calls one morning and she goes, "I can't come to work." And I said, "Are you okay? What's wrong?" And she said, "I'm in the emergency room." And she is under an Medicare Advantage, which we tried to talk her out of doing. We're like, "You don't need to do this." She goes, No, I want to save the money. I want to save the money. She insisted on doing it. And so she did. She goes to their hospital. Now, we're in the DC area, okay? She goes to their hospital and she said, "I've got a appendicitis. It's ruptured." So I said, all right. So we got in touch with her family. You know, we were being kept abreast of it all. The next morning, I get a call from her, and because I'm like, why aren't we hearing from the family as to what's going on? She did not have the surgery. She sat there for 24 hours. They couldn't find a surgeon available to do it. I was so incensed. I said, "I'm getting in the car. I'm coming out to pick you up. I'm taking you to another hospital." I mean, I thought she was not going to survive this. And
she's lucky she survived.
It was a miracle. And she finally, you know, before I could get out there, I guess she said, "My family, you know, they're coming to get me." And they got someone in, and the surgeon came out to her niece and said, "What a hot mess this was." And it took her months to try to do that. And I can see a difference in her health since she basically, I don't know how she didn't die from sepsis. And we were so appalled and so upset about this. But this is what we're hearing, stories all over. And that's what I'm saying. And you look at even the older population, but cancer diagnoses have been so increasing in younger families and younger people.
That's true.
And they're actively working. They've got children, you know, so it's across all ages, all socioeconomic basically levels. Because even people that think they've saved enough money for retirement,
it's gone. Shortly.
It's gone. Yeah. What we find too is that patients who think they're moving through their life just fine with what they have, and they get a diagnosis of cancer, and it just completely upsets the apple cart. And the next thing you know, we had one gentleman tell us that if it hadn't been for the foundation's help, he would have been homeless. And this was a veteran of Vietnam, I believe. So, you know, it's just amazing what can happen to people who one day you're fine and the next day you're not.
That's right.
I think another thing that I really am enjoying hearing about is that y'all don't really discriminate against, you know, the cancer. It comes in everybody, but you're looking to help everybody, any age, you know, however it's affecting, which, you know, I commend that. But do y'all have a 2024 goal of how many people you are looking to serve, or do y'all have you know, I know you said that y'all have a fundraising goal, But is there a goal for the number of people that y'all are hoping to serve this year?
We haven't really set that kind of a goal. We wanted to get the money raised and then start. We've got an application that we've developed that the foundations can complete and submit to us. We have a grant committee that will review all the applications and then make the grants. But we haven't said we're only going to reach 2 people. We would like to have more than that, and that's one of the purposes of our fundraising goal is to have enough money that we can give resources to the local foundations that are more than just a couple dollars.
Yeah, absolutely.
Who all is involved in the foundation? I know you mentioned, Diane, the first time I talked to you that you had a number of physicians involved. What types of folks are on your board and involved in the foundation itself?
Well, there's medical administrators. There are people. We have an accountant that has worked with medical groups from, cancer groups from all different kinds of organizations, and has been a great help. We have him. Who else, Peg? Some nurses.
Two physicians. A couple. A treasurer from one of the practices. Trying to think who else is on the board. We're definitely wanting to expand it and get more community type. Most of the people that are on the board right now are related in some way, shape, or form to a practice, and we'd like to have more people like Diane, who is not affiliated with a practice, who can really, bring in that community experience.
So are some of the physicians oncologists?
They're all.
Oh, yes. Yes.
Rheumatologists, and they actually were the ones who, because they had their patients watching them, deal with this and struggle with this, is what started it. I guess we really should explain, Peg, and you could do this probably better than me, that what the National Care Alliance is and how this all came about. That may help clarify that.
Yeah, the National Cancer Care Alliance was a group of practices, medical oncology practices that came together just to share experiences and best practices and to identify problems that they were having and how do we solve those. And one of those problems was, how do we raise money for our local foundations? And how do we take care of our patients? So it's been a very a good working relationship among the practices. And you can, the nice thing that when I was in the practice, the nice thing was I could pick up the phone and call somebody from some other practice and say, I remember you saying something about this. Can you tell me what you did? Because we're now facing that particular issue too. So.
I think shared experience, right? Shared experience and support on all levels is crucial.
Yeah.
It's crucial. And also hear, because they're from all over the country, what's going on and the feedback and what that particular group. And I will tell you that the person that spearheaded this was Barbara McEnany, who's a physician, Dr. McEnany, oncologist, hematologist, practices in New Mexico. Barbara's the past president of the American Medical Association. And so she has seen all of these issues across international, national, locally. And she started her foundation over 20 years ago. And she's in a little bit different situation. She's in a multi-specialty group. So they do have some cardiology patients and, the different specialties that are within that practice. And when they started their foundation, and one of the things I need to explain with all of this is these foundations are separate, standalone. They are not part of the practices. They are not part of any other organization. The Cancer Safety Net Foundation is an independent, entity to itself. So nothing goes back to these finances, but they saw the need and either went to community leaders within their community or put the seed money up themselves, pulled in people from the community, put a board together. But that's how it started. It was actually the medical physicians and nurses and administrators that said, we need to do something. There isn't any resource for people. And that's how it evolved. And they then, the NCCA as a whole, granted the funds to go through the legal and regulatory financial requirements to set up a foundation nationally. And we have one physician, in fact, we have two physicians with international ties, and they would both like to see us eventually take this internationally. So we're brand new. We basically, the last year has been getting everything put together, getting all of, and we're incorporated in Tennessee because that's where our CFO is located. And we basically have, but we're across all, all states and all federal. We've gone through all the federal rules. We've had 3 different legal companies, legal firms rather, going through everything. We've gone through all the nonprofit, all the hoops and jumps that you need to go through. So we're officially set up, and so anyone who would be interested, and our website, which John, thank you so much for putting up on the screen display. People can go to the website. There's some testimonials on there from patients, as well as they can contact us through there if they're interested, whether it's a corporate type of a partnership that somebody wants to get involved in, with larger funds. If it's an individual person that would just like to give us a donation, all of that can be done through our website, and we can, and they can get in touch with us as well.
Well, and so I want to go back to what we were talking about earlier about connecting with companies and how that could be really important. And a business, right, is there to make profit or revenue, blah, 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 blah. So truthfully, this is a way for them not only to do good for the community, because we know that this is something that helps the community, but you want to hedge your bet against your employees that you're probably going to have an employee that is diagnosed with cancer, and they're going to go through the roughest time in their life. And they're going to look to a lot of people to help. And what are we going to do? And if they're already connected with y'all, if they're already giving resources that way, it probably helps. And I think time is probably the biggest issue, right? Like if I don't know about this until 3-4 months after I got started, I might be in a worse position or have had stuff happen. So I think it's crucial that we let everybody know that that this is out there, right? And how to get a hold of it. But then, the importance of connecting and raising funds so that there is money to be given to people that are in need.
Exactly. Yeah. And that's one of the things we're doing. We're networking. We have started doing our own grant applications to different companies, as we said, and Peg's been spearheading that. And I've been trying as much networking as we can do, because, I'm talking to everyone and, going and trying to, I have meetings scheduled, next week. We're, saying, okay, here's what we're putting together. Network this year. You never know who you're going to tell or who you're going to talk to. Yeah. It's going to go, oh my gosh. The foundation Peg was involved with locally, you can tell them about the grant that that would be good to tell them of some of the ways that people can provide money. The patient's family that gave you a specific grant. Peg.
Oh, sure. Yeah, we had a patient that she gave through her will, she gave money to the foundation. And then we've started a number of different fundraisers so that we're adding to the amount of money that's available, and that our local foundation grew fairly significantly over the last year with these different fundraising activities. And that's what I hope to see happen with the Cancer Safety Net Foundation, is that our fundraising initiatives will add to the coffers so that we can do like we're doing locally. We used to only be able to give people $100 towards something, their rent or their utilities or whatever. But now we're up to $1,500 because of all the different things that we've raised money for, and we're wanting to do more. So, having a grant from the Cancer Safety Net Foundation will help the local folks significantly.
When I was the administrator for our cardiology group, I had many people come into the office, and Diane, I think you said it earlier, you know, you have people sit down going, I have to choose my life or, you know, taking care of my bills and these sort of things. And I think as a private practice, I was able to work with them because my physicians own the practice, so that we were able to do financial. But I think as we start to see more and more of these mega, you know, big sort of corporate, if everybody's a number, there means there are less resources, less flexibility in the office. So it just means that this, you know, we need these sort of foundations, this sort of education and outreach more than ever now, because everything's consolidating down, which I think the resources are consolidating with them.
And I think it's also a lesson that people that are still working and still in a situation, and I think eventually we need to bring government officials into this as well. They need to understand with, you know, the budgeting and the cuts and all the stuff that's happening, that we're going to end up with more social programs because of it, you know, because they don't have the care, because they can't afford to take care of themselves. And you know, we're seeing the middle class shrinking. We're seeing all of these different things happen, and it's all a result because there's been so many changes, and you know, Medicare, you know, people were guaranteed they were going to have this in their retirement. You know, if we may go bankrupt, you know, in that many years as well.
That's true.
You know, so that's another issue. So we, you know, and then we have, you know, the children, you know, you look at some place like St. Jude's and places like that have helped children, and they're begging for money. They need more because they're having more children show up on their doorstep. And, you know, there's so many different things affecting us, from the environment to, you know, you name it, that are all leading to this. And you don't have a lot of the infrastructures and the families that are able to help each other. I mean, we've all had that. We've all been caretakers. I mean, Arlene, you've done it. You know, all of us have done it. Peg has done it, and that we're taking care of either the grandparents, the parents, the kids, the grandkids, and it's taxing. It's exhausting, and taxing, and you know. But there's not always that available for families. They don't have that support group.
And I don't think there's anything more demoralizing than not being able to take care of your family. You know, like to have to look at that. It's just like, what am I going to do? And nobody wants a cancer diagnosis. So this is not something that anybody wanted. So it's like double piled on. But yeah, it's so needed that what y'all are doing, because we have all seen a personal experience, and it's never one that is an easy one to go through. So any way that we can support or help advocate for these individuals is so important.
Thank you. Yes.
I'd really like to see both of you come back on at a later date and talk about how you've progressed. As with all of what you're doing, you know, we'll
maybe bring one of the family members on as well if they have, you know, because we would love to hear from them.
Story to tell, I just think that, like, probably within the next 6 months, my guess is with the inflation, the way it's going, and the cost of everything, that the need for what you're doing is exacerbated tremendously. I mean, it's just, I just can't imagine what some of these people are going through right now, and not being able to afford the food. And
the grocery prices alone are just
yes.
They just skyrocketed.
Yes, and that's what you're hearing the most about is the grocery prices. They can't afford to buy food. I mean, heavens, the other day, my daughter-in-law asked me if we could help make some sandwiches for the wrestling team, because the cost of buying the food for the wrestling team was more than most of the families they couldn't afford it. So I said, sure, I can afford it.
Yeah.
So.
Yeah.
That's just the you know, the basics. I mean, there's a million other things. You know, clothing. If they've got small children, 3 months they're out of their shoes, or they're
Exactly.
It just adds up and compiles. And if they get reduced in their hours at work and their income goes down, or it's like a vicious cycle that they get into.
Right. Yeah, it's like it starts and it just snowballs and gets worse. And I think that's what I was trying to say earlier, and I don't think I said it well, but that's why I think timing is so important, to get these resources to them as quick as possible, because we want to try to stop, maybe hinder, slow down, stop completely any of these issues that might come up. And it's amazing that y'all are dedicating your time and energy into this. It sounds like y'all probably could be, relaxing by a pool, or, being selfish, but y'all are taking your time to do this, which is amazing. And so I commend y'all for doing that, as it's a big task that y'all are setting out to.
Yes.
We're honored that Arlene, I mean, I'm just so excited that Arlene and I connected. I knew actually her brother. He had actually helped me with some things over the years. And I'm just so excited that you invited Peg and I to be on this, and just to
Yes, I really appreciate it.
Of course,
absolutely.
of course.
And
we will, go ahead.
If they're interested also in joining us, and joining the board, and being that can offer services. I mean, there's so much that is needed, and we set up our bylaws and our structure with, right now we have 8 members, but we can go up to 20, and we did that on purpose so that we could have the advantage of having other, influencers and corporate people, and people that, have connections as well as what we need.
Sure. So those folks who need help can get on your website at www.cancersafetynet.org. Yep. And anyone who is interested in donating can also use that same website to do the donations. So we would encourage anybody who's able to. Like I said, we've all experienced cancer in our lives in one way or another. So whether we've had it or family members, friends, so it's certainly is something awful, and none of us want to have that diagnosis. But the end result of it is not pleasant either. So again, we would love to have you back on and let us know what your progress is. And I just think you're just doing an invaluable service. Thank you
so much.
Thank you. We appreciate the time today.
Yeah. Awesome.
And to help to educate other people about what is going on. And we're happy to answer any questions. We're happy to talk to other groups, anybody who we're willing. We're happy to.
And we can help practices start their local foundations too.
Oh, there you go.
Absolutely.
That's interesting. Oh, good.
Awesome. All right.
Next week, Don, I just wanted to mention, next week we are going to do something, workforce, and both of you know what we're talking about here with the workforce in the healthcare industry is shrinking. And some of the studies that have been done indicate that leadership, the lack of leadership, is one of the reasons that that's happening. And so next week we are going to be honored to have someone by the name of Laura Barnett, and some of you in the Dallas area are going to recognize her because she was a TV anchor for a number of years in Dallas. And Laura is going to come on and she's going to talk about that leadership issue and the workforce shortage and what we can do about it, and some training that might be available for folks who want to get into those leadership positions, and help with the workforce shortage. Diane, you were talking about how your friend went into that emergency room and was sitting there for 24 hours. Some of that could have been due to not having enough staff. Who knows? There's all kinds of things that could have happened.
They didn't have enough time not have a surgeon to take care of them.
So next week
you see it all over the place.
Yeah, for sure.
And Arlene, did you want to talk about Agile as well? Do we have Agile coming up in a couple of months?
We do. On the 27th of March, we are going to have 1 full hour dedicated to Agile. Agile is a leadership conference that will be held in the Dallas area in April. And so in that March podcast that we do, we are going to have some of the executives from the Access technology on and talk about Agile, and the speakers. They're going to have some phenomenal speakers there. So we want to make sure that everybody has an opportunity to listen to that. And we want to make sure, John, that we get people to sign up for our podcast, right?
Yes, yes. And we definitely need you to subscribe and like and share this podcast so that you can stay up to date with all things healthcare, with, of course, the amazing, the wonderful, extraordinary Arlene Maxim.
And the remarkable John Kublank. Don't forget that.
But again, thank y'all, Diane, Peggy. We really do appreciate y'all's time today. We just enjoy getting to hear about what amazing people like y'all are doing, and just to hopefully help y'all spread your message just a little bit more. So thank you for your
we
time.
appreciate your help.
Yeah,
absolutely.
We really do. Thank you.
And thank y'all, everybody, for watching Off the Cuff All Things Healthcare. Next week, great episode with Laura, and Arlene will be there. So please, again, hit that like button, hit that subscribe button, and we'll see you next week. Thanks, guys.
Bye-bye.
Bye-bye.